So we developed, along with Dr. Martin Pule and Dr. Claire Roddy, a novel CAR T-cell therapy for calreticulin-mutated myelofibrosis. Myelofibrosis is a very challenging disease. There aren't many curative treatments other than an allogeneic stem cell transplant, which is only available for a small subgroup of patients. And even in that setting, there is up to 25% treatment-related mortality. There have been quite a few treatments that have become available in the recent years, but none of these treatments are really disease-modifying. They're not curative treatments. Calreticulin is a fascinating molecule because the mutations in this protein results into a novel C-terminus, which we can target specifically with a binder that would only target the expression of mutated calreticulin in the malignant cells. Now also it gets more interesting because in order to cause the disease, mutated calreticulin needs to bind to the thrombopoietin receptor. They are expressed together in the surface, and that leads to an aberrant activation of the thrombopoietin receptor, firing up the malignant clone. And immunotherapies can target molecules that are expressed on surface of cells, but this molecule is only expressed on the malignant clone. It is not expressed on the normal cells, and it is the product of a disease-driving mutation. So the perfect triad for an immunotherapeutic approach. So our CAR T-cell therapy has been able to eliminate cancer cell lines that they are bearing this target, and then we tested it against patient samples. We isolated stem cells from patients with myelofibrosis, and our CAR T-cell therapy was able to eliminate the malignant clone among these stem cells without having any off-target toxicity against JAK2 mutated stem cells or other irrelevant targets. Our next step was to test our CAR T in an in vivo model. So we used an NSG xenograft model with a quite aggressive cell line that usually induces death in mice within 2 to 3 weeks. And our CAR T was able to control the proliferation of this cell line and to statistically significantly prolong survival in murine cohorts. We also looked for evidence of tumor in these mice after treatment with CAR T-cell, and the tumor was almost completely eliminated. And also the CAR T-cells were able to expand in this murine environment and work very well. So we're very excited about this treatment. We want to take it to the clinic. We think that it could potentially be practice-changing. And hopefully we will be able to start a phase 1 first-in-human trial where we will be testing this treatment on calreticulin-mutated myelofibrosis patients. So I would like also to thank our collaborators in the University of Oxford. Beth Seiler Lab and Zoe Wong have done some of this work. Also my supervisors, Dr. Claire Roddy and Martin Pule, as well as the MRC and the Blood Cancer Research UK, who have funded this research that wouldn't have been otherwise possible.